So today I'll be talking to you about the pathophysiology of stroke. So the underlying structural and functional abnormalities that can result in a stroke. So they're grouped hierarchically based on their etiology or cause. So you might recall hemorrhage or rupturing of a blood vessel, so blood vessel rupture. Is the one type of stroke, and ischemia or low blood supply is the other type, or low blood flow is the other type of stroke. So first, hemorrhage is divided again into two categories based on what happens, based on the underlying mechanism. And the first category is subarachnoid hemorrhage. And as the name would suggest, it's a hemorrhage that occurs in the subarachnoid space. So what arteries are in the subarachnoid space? Well, all the arteries in the circle of Willis, which we have here on the right. Circle of Willis supplies blood to the brain. There's four main spots where subarachnoid hemorrhages usually occur. They are here at the junctions of collateral circulation. So again, subarachnoid hemorrhage leads to blood leaking into the cerebral spinal fluid. So you have high pressure in subarachnoid space, in the head, and that leads to what patients describe 97% of the time, when they have subarachnoid hemorrhage at least, the worst headache of their life. Worst headache ever. So now you kind of understand how the symptoms can arise from the underlying physiological mechanism and changes that occur. And the other type of hemorrhage is intracerebral. So here, bleeding actually occurs in the brain. So what happens is basically the vessel is inside the brain, rupture, and you get a hematoma, or a local collection of blood outside of vessels. And this snowballs, accumulates, you get more blood, it spreads to the white matter, and pretty soon you have a big problem. You have stroke, you have local brain dysfunction. So that's actually the difference between how intracerebral and subarachnoid hemorrhages manifest themselves. So with intracerebral, you often get local dysfunction of the brain, whereas with subarachnoid hemorrhages, you usually see diffuse dysfunction of the brain. So the whole brain is experiencing this splitting headache. So those are the main differences between the hemorrhages that lead to stroke. And so next we're gonna look at ischemia, which is the other main type of stroke. So ischemic stroke. So there's actually three main types of stroke. So one is thrombotic stroke. And here basically you have decreased blood flow due to an intrinsic problem with the vessel. So this is like an intrinsic problem in the vessel. And for example, like atherosclerosis, vasoconstriction. I mean, one main example that I wanted to bring up that you might remember from your hematology and immunology classes is how endothelial activation can lead to platelet aggregation, which can in turn interact with fibrin molecules. So fibrin interactions. And this in turn leads to the formation of a platelet plug. And this platelet plug then goes on to form a thrombus, which then narrows the artery, creating a stenotic artery where you have decreased blood flow, decreased nutrients, decreased oxygen to parts of the brain, parts of the body that really matter. So there's two types of thrombotic ischemic strokes. The first one is small vessel or lacunar stroke / infarct, yeah. And the other one is large vessel. So small vessel stroke usually arises from etiologies that cause problems in small vessels. For example, there's lipohyalinosis, which is the deposition of like fatty hyaline matter, and that's due like, for example, high blood pressure, aging can all lead to this deposition of this lipid, like fatty hyaline matter. Large vessel ischemic strokes are often due to, as I mentioned previously, atherosclerosis or vasoconstriction. So that's thrombotic stroke. And the other type of ischemic stroke that we see relatively often is embolic stroke. So here you have the formation of an embolus. An embolus is any solid, liquid, or gas that's not blood, obviously, that travels. Excuse me, let's get some more room around here. That travels through the vascular system, like from its site of, like to a distance point, like from its origin, and lodges there. So through vascular system and lodges at distant point. So you can imagine, you can have, for example, in the lung, have an embolus. So here's your heart. In the lungs, you can have an embolus forming, and it can be passed through the heart, up through the carotid arteries. So leaves the aorta here, enters the carotid arteries, and then you have an embolus formed over here, jumps through the heart, goes up, and then lodges itself in an artery in the brain. And then you get stroke. Okay, so that's again embolic stroke. In order to eliminate it, you have to treat the underlying cause. So treat underlying cause. So what are some underlying causes of embolic stroke? For example, obesity, anything that can predispose you to like forming thrombotic plaques at other parts of the body, sedentary lifestyle, the risk factors we talked through at the during the first set of lectures. And the third pathophysiology of ischemic stroke is systemic hypoperfusion. So here you have a heart, but it's not pumping out, it's got low cardiac output. So low cardiac output. Low or abnormal cardiac output. So for example, cardiac arrest, arrhythmia, myocardial ischemia, pulmonary embolism, pericardial effusion, bleeding somewhere else in the body can all lead to systemic hypoperfusion. So that sums up the pathophysiology of stroke. Thank you.